Good evening, everybody. Thank you for joining us on Taylor Tuesday. We've got something interesting tonight. Tonight is the first time we're going to be doing a live presentation. Not that our speakers aren't present, but we're actually doing this in a studio meant so that you can actually see the sonography that's being done. We're joined tonight by John Zentz. He's a RVT and an RDMS. He works for one of our trusted partners, somebody that came on from the beginning, Vision. They are a company that specializes in ultrasound, whether they're new or refurbished. They provide a great offering. They'll meet the needs of your practice based on the type of device that you're looking for. So I'm really excited. I'll tell you a little bit more about John in a few minutes. I'm really glad that you've all joined us tonight. We've been doing this now since COVID started, probably, I'd say we started in March. Normally I do it with Dr. King, so I'm a little bit lonely tonight. I'm flying solo. But that was actually because we're doing this live presentation and it doesn't allow us to have extra people. But anyway, I think that you all know we archive all of our webinars. They're available on the Taylor Medical website, www.taylormedical.com. Look in the upper right-hand corner where it says webinars, and all of the webinars that we've done have been archived. So if you enjoyed it or you wanted to share it with your staff or other colleagues, feel free to do so because it's always available. That's what it's here for. We've really been trying to build, a family. We really think that we look to help your practices in a multitude of different fashions. And I think that you really enjoy what we're doing tonight. For those of you who haven't taken the opportunity, we welcome you to do a personalized cost analysis at no charge. You can send us your products in an Excel spreadsheet. If you can't get an Excel spreadsheet, some of the vendors, they can download it off your website. I'm technologically impaired. I wouldn't know how to do that, but our team, Carla or Ashley or Siobhan, would be able to help you download your 12-month spend where we can do a cost analysis. And what we will do is we will actually compare your cost analysis of buying the exact same products versus putting in branded products by our distributor, by our partner, Medline. So we do what I call apples to apples and apples to oranges. And our goal is to save your practice money. But we're more than just doing that. I think that anything that you need in your practice, Taylor Medical is capable of supplying for you. Whether it's diagnostic ultrasound, whether it's x-ray machines, whether it's treatment chairs, whether it's an autoclave. I think anything that you could think about using in your clinic, before you go somewhere else, please check with us at Taylor to make sure that we can do it better for you and help you out. We're also here to help you bring in new technologies and practices to your clinics that will help you get better patient outcomes, because it's really all about the patient outcomes. So anyway, I'm going to turn it over to John. He's a registered sonographer with 25 years experience in patient care. He's taught ultrasound physics as an adjunct professor at Volunteer State Community College, and he's the applications and product specialist at Vision for the last year and a half. So, John, I'm going to make this disappear, and I'm going to hide myself, and I'm going to turn it all over to you. How's that sound?
Sounds good.
And then I'll come back, at the end.
All right. So today, what I'd like to talk about is the basic settings on ultrasound machines, how to optimize those so that you're getting the best images possible. A lot of people, they're handed ultrasound machines. They get a bare minimum of training. They learn a couple of knobs, the gain, depth. That's about it. And they're not satisfied with the images that they're getting. So what I'm going to do is kind of go over some of the primary settings that are user adjustable, that almost every machine on the market that you're going to find in your clinics will have. Even some of the small tablet type ultrasound machines will have almost all of these settings available to adjust. And it'll really help you dial that image in so that you're more comfortable. You can see what you want to see, able to confidently diagnose what's going on. So the first thing, so the machine that I have here, it's a small laptop machine. It's made by Sonoscape. It's the E2. It's one that we're finding more and more often in the small clinics, but it's easy for me to show all of the adjustments on this machine. That's why I pulled this one in. So I'm going to go ahead and switch to the image. So this is the machine. We're going to go ahead and zoom all the way in to camera 3 here. And so what I'm showing here is an image. And the first thing we're going to talk about is the gain. Gain is the overall brightness. Sometimes you're going to see this as B. It'll just be labeled with a B. Sometimes it's labeled as a 2D. Sometimes it just has a big auto button, and then gain is written in small letters around it. So this image is undergained. It's a little too dark to see what you're after. And then this next image, once again, is the exact same spot, just too bright. This one is dialed in to just about right. Now, that's the only setting that I adjusted between these 3 images is just the gain setting. So first thing you want to do, don't try to see what you're looking for. If your image is too dark or too bright, go ahead and turn that knob a little bit and make the adjustment. Yeah, but that's probably one that almost everyone is familiar with. Every machine should have that knob or button easily available. So next thing in line is depth. This is where I see a lot of people making a mistake. So this image is an example of depth and focus. I kind of tied the focus in with the depth because they're both adjustments that need to be made at about the same time. So what we're looking at here is the Achilles tendon, across the top of the screen. But our depth is set way down here, and our focus is set down here. So the machine is optimized for the depth way down here, not the Achilles tendon that we're actually looking at. So all I've done here is adjusted the focus. So now you can see the focus is right up here at the Achilles tendon. So I'm going to go back to the other image and just watch that tendon, and you'll see right now this tendon is kind of hazy. You don't really see a lot of detail in that. When I move the focus up, you can see all of the fibers a whole lot better in that tendon. It's a much sharper image of that. And when I bring the depth up to match, at this point, this system is optimized for that tendon. It will adjust a lot of parameters inside of that machine to really optimize it. And you can see these lines inside of the tendon a whole lot cleaner, a lot sharper. So if you're looking at something at the top of your screen, don't leave your depth set way down. Go ahead and bring that up. Are there any questions about this so far?
I've got none so far, John. I will tell you that I've got a couple of comments on the clarity of the picture. So obviously, everybody is really appreciative of the view and the clarity of the ultrasound that you're providing.
Good to hear it. So those are 3 basic parameters. Every machine on the market, even the little V scans, can adjust your depth and your gain to really optimize this part of the image. At this point, we're going to start getting into a little bit more advanced stuff. So this image is another depth focus with, this time we want to see down here. We've got our focus set way up here, and we don't really see much down here. It's all mud. when we bring that focus down, you can really see the difference in this tissue. So I brought that focus way down to here. And so I'm going to go back so that, and pay attention to the bone, right? This is the bone right here and the tissue right next to the bone. And you can even see a little fluid layer right here. So we're going to go back a step. This is with the only difference between those two images is where I set the focus. So this is the focus in the wrong place. That's the focus in the correct place. So, significant difference in the clarity of your image. Okay, so the next thing is frequency. In the market, all we hear about is, I want a high frequency linear probe. But the highest frequency isn't always the best option. And most machines on the market will allow you to adjust the frequency as you're scanning. So this machine has a pretty wide range of frequencies with its linear. And so what we're looking at is the anatomy down here again. Okay, so I've got the frequency set really high at 10.9 to 14. I don't know if you guys can read that or not, but this is set at the highest frequency possible for this transducer. Okay, so we lower that frequency, and that's the only difference between these two images, is just dropping that frequency a little bit. With ultrasound, it's always a trade-off between resolution and penetration. You raise the frequency, you get good resolution, but you lose penetration. You drop that frequency, you lose a little bit of resolution, but now we can actually see what we're after. So look at the difference between the bone line and all of this tissue here. And I'll go back to that previous image with the high frequency. And you see we've lost everything. The sound just can't get there. So it's just losing all of its gas trying to get down to that level and back. So, and I'll show you, once I'm done with this part of the presentation, I'll show you where the adjustments are on this machine, and you'll be able to find them on any other machine that you have. There's most machines have an allowance to do frequency. Sometimes you'll see it as a little triangle where you have penetration, general resolution. And so they don't tell you you're adjusting frequency, but that's what you're adjusting. So here is an example of using a frequency that's too low. So once again, we're optimizing for this Achilles tendon again. And we don't really see a lot of detail in this tendon. We've got our depth set properly, our gain is set properly, our focal zone is set properly, but we're just not seeing a lot of tendon. And so I've got the frequency set over here between 8 and 9.6 megahertz. So if I adjust that, now I've got it set back to that 10.9 to 14, and you can really see the details in that tendon. All those linear structures, you can see the fibers. You're able to see that much better. So even in an ankle, frequency is important. It's going to make a difference. If you're trying to look deep into the ankle at the actual ankle joint itself, you're going to need to lower those frequencies a little bit to really optimize it for that depth. And the other time when you're really going to want to adjust frequency is patients with really dry, scaly skin. So you'll find that you put the transducer down, you gel them up, and you just aren't getting an image. So what you do is drop that frequency, get it to punch through that skin. That's the first thing that you should think of. If they take their socks off and they've got that super dry, scaly skin around their ankle and foot, go ahead and drop your frequencies just so you can punch through that skin layer. Okay, the next setting is harmonics. Almost every machine on the market now has got a harmonics setting. So this image has harmonics turned on. What harmonics does is it's going to send out a pulse of, say, 4 megahertz, and it's going to listen for a return pulse of 8 megahertz. So it's listening for that higher frequency signal. What that's going to do for you is going to get rid of some of the speckle and scatter. It's going to bring in those finer structures. Most of the time, you're going to want harmonics turned on. Probably the single biggest thing harmonics does for you is allows you to see fluid. So right here is that fluid collection right there next to the bone in that ankle joint. Just a little trace amount of fluid. This is absolutely normal. There is nothing wrong with this. But we can actually see that. As soon as you turn off harmonics, now we can still see something there, but it's kind of fuzzy. You're not able to appreciate it nearly as well. And the only difference between these two images is harmonics off versus harmonics turned on. And so, pretty big difference in what we're seeing. We're seeing a much grainier image because it's using those lower frequencies. The fluids don't clean out as well. It puts a lot more speckle inside of fluid collections, so they're going to be harder to appreciate on ultrasound. Are there any questions up to this point?
None right now.
Okay. So harmonics is something you're going to want to leave on most of the time. Once again, if you're having a hard time penetrating, drop your frequencies. If you still can't see, turn off your harmonics. And that's going to give you the best penetration that system is going to give you. So the next thing I'm going to talk about a little bit is the spatial compounding. Every machine has to call it something different because everybody trademarked their name for it. Back in the old days, ultrasound image was created by sending a pulse straight down into the tissue. It hits its targets and comes straight back.
Hey, John.
Yes?
Since we're on this area, and you did ask if there were questions, I think on the previous slide, I got a question that said, from one of our attendees that said, I have an older unit. Is that why my image always has so much static?
It could, there could be a couple of things. Some units have a speckle reduction feature. And so if it's an older unit, it probably doesn't. But if you do not have harmonics, then yes, your image is going to have a lot more fuzz over it, just like this one does, compared to that. So this is harmonics on. It cleans up a lot of that scatter and fuzz. Where turn off harmonics, we have this. There are a couple of other settings that you can adjust. So the first thing I would try, if you've got a lot of that haze over your image, the first thing you want to try, if you have harmonics, turn it on. If you don't have harmonics, go ahead and try dropping your frequency. The lower frequencies will not give you as much scatter as the higher frequencies will. Check that focal zone. Focal zone is very important. Keep that focal zone down towards the bottom of your image. That will help with some of that scatter and some of that speckle. But use lower frequencies. Make sure your focal zones are down. Other than that, it may be the unit not having harmonics, not having speckle reduction, and that's okay. We can still see the anatomy we need to see most of the time. You don't need the absolute latest, greatest, fanciest sparkles on your machine to get your job done, but it does make it nicer. But yeah, check to see if it has harmonics, if they're turned on or off, and check those frequencies. That's what I would recommend to try to get rid of some of that. You'll see, in fact, down here on this machine, this U-scan feature, I've got the arrow kind of pointed at it. That is the speckle reduction feature that's built into this ultrasound system. That's Sonoscape's version of speckle reduction. And so I've got it turned up to 3 right now. If I turn it off completely, you're going to see some more haze across the screen. In fact, I can turn it off there. So we see a little bit more. And as I turn that up, you can see a little bit of that starting to go away. Are you able to appreciate that difference?
Yes.
Okay. So right there, it's turned all the way up. There, it's turned off. So the main thing I'm looking at, the easiest place for me to look to see is this area that's supposed to be completely black, because there's bone and we're not getting any sound behind it. So we have this, kind of gray through there. And the more I turn this up, the more it cleans that out. And so that tells me, because that gray is going to be covering your entire image, not just this area that's supposed to be black. And so the more I turn that speckle reduction up, the less of that speckle you're seeing here. The other thing that helps get rid of that, if you have a frame averaging setting on your machine, that's getting into a more advanced setting. But some machines have a frame averaging, and you can play with that. If you turn your frame averaging up, that also will help get rid of some of that scatter. So, okay, back to compounding. So this image has compounding turned off, and it's showing you there's one line of sight. It is sending that pulse straight down into the leg or foot or whatever, and so that pulse goes straight down, comes straight back. So for about the last, I want to say 15 to 20 years, 20 years ago, it started getting popular. Now pretty much every machine has got spatial compounding. They call it sono-CT, multi-beam, lots of different words for this. But what it does is your machine is shooting multiple lines of sight. So no longer is your beam going straight up and down, but it's also shooting diagonals. And this allows us to see a lot more detail. It allows us to see around a few items because we're actually shooting at angles so we can see around things. If you have, a solid reflector right here completely blocking sound from going straight down from that point, well, this beam that's at a diagonal will see what's behind that. And then that same, this angle over here that's shooting from this side, we'll see around it from that other side, and you'll actually be able to fill in that data and get an image behind stuff. So you definitely want spatial compounding turned on. That is a very important feature, especially with musculoskeletal work. You have a very specific artifact that deals with musculoskeletal work, anisotropy. It's a fancy word for when you hit something at an angle, you don't always get your sound beam coming back at you. And I'll show you an example of that here in a minute. But most machines will have an adjustment. So, here's 3 lines of sight, 5 lines of sight, 7 lines of sight. And this machine will actually get you all the way up to 9 lines of sight if you want it. My preference on this particular machine is this 5 lines of sight. It's a real sweet spot, gives you a really clean image. So here is an example of an image with spatial compounding turned off. So right here is a tibial vein. We have your tibial artery, another vein here and another vein here. Notice how it all kind of mushes together. It's kind of hard to see the actual borders of the veins. We can see the top and the bottom borders pretty good because our beams are going straight up and down. So we can see that top and bottom border, but we're missing all of our edges. When we turn that on, and I'll turn that, there we go. Now you're able to actually see a round structure here, a round structure. So you can see the actual round structures because with those angled beams, we're able to pick up on all of these side walls and a lot more of the structure of those veins. Does that make sense?
Completely.
Okay, so where this really comes in for musculoskeletal work. So right here, once again, we have the Achilles tendon. And we can see that Achilles tendon all the way down to its attachment points. You know, it's attaching all along the bone right through here. And we can see pretty good detail all along that. You know, this image, I didn't try real hard to fully optimize it for this section. I just put the transducer down and snapped the image with spatial compounding turned on. There it is with spatial compounding turned off. So huge difference. This is that artifact that I was just telling you about, the anisotropy. What's happening is our beam is hitting these ligaments, tendons, any structure like that. When it hits it at an off angle that's not perpendicular, we lose our sound beam. It just gets lost in there somewhere and doesn't come back to us. And so our image looks like there is nothing there. Maybe a fluid collection, maybe it was torn or ruptured. When we go back to it turned on, we can actually see the whole thing there. So angle is critically important with any musculoskeletal work. And this is your guys' meat and potatoes. When you're looking at all of the ligaments, tendons, muscles, things holding the foot together with ultrasound, these are the things you're looking at. And so if you don't have that spatial compounding turned on, you have to hit everything dead on perpendicular to get a really good clean shot on it. Anything that hits an angle is just going to disappear. So any questions?
No, sirree. Wait, hold on. Are there any particular parameters for gain, depth, and focus settings for particular foot pathology?
No, not necessarily. What you want is basically an even grayscale throughout your image. So you don't want it too dark. You know, this machine allows for post-processing. That's how I'm able to adjust these images after the fact. About half the machines out there will let you take an image that you've already taken and adjust a few parameters, you know, like that speckle reduction, like the gain. So if I turn this down, we just can't see anything. Too bright, once again, now, you know, we're just filling in all those dark spots with noise and not getting anything. So you're going to have to find, you know, that nice even grayscale that's kind of pleasing to your eye. The big thing that you need to keep in mind, a lot of machines have an auto gain function. And they market that pretty heavy, especially to guys doing point of care work that don't want to fiddle with a whole lot of buttons to optimize the image. They just want to hit that auto button and let the machine take care of the gain. Don't get suckered in by those. The biggest problem I see with those is they're optimized and the computer is trying to optimize that image for a sonographer in a dark room, which means the image is going to be too dark if you're scanning the patient in a regular exam room without turning off all the lights. So, you know, that's probably going to be the biggest thing is you guys are not in a regular ultrasound exam room with all the lights out, you know, so that you can really optimize those shades of gray that your eyes can see. You're just not there. You're in an exam room looking at a patient with the lights on. So your gain is going to have to be set much brighter than it would be, you know, if you were in a dark room. And when you hit that auto button, you know, it optimizes that image for dark rooms on most machines. There are a couple machines out there that actually allow you to adjust the auto gain functions, you know, to be brighter or darker for your preference. But my suggestion is don't trust any of them. You know, find that gain knob, you know, go up a little bit, notice that, yeah, that's too bright. You know, go down a little bit, think, oh, that's too dark. I can't really see what I need. You know, you're going to find just by trial and error that shade of gray that's good for your eyes in that lighting at that time. There's no magic number that will work. So the next thing that I do want to talk about, and this is not something that most people think of, is dynamic range. Once again, that's another setting that's available on almost every machine. And the only reason I mention this is because it's really handy for needle guidance. I'm not a fan of any of the needle guiding software that's built into any machine on the market right now. There's a lot of them. They aim the beams of the transducer certain directions. Some of them will detect movement and color it shades of blue or red or, whatever color they want to shade it. I find that needle guidance settings on the machines are more cumbersome to use and don't really help in the long run. The trick is get your other settings right, and you'll probably see your needle pretty good. But the one thing that really will help is your dynamic range. And so on this machine right now, my dynamic range, and you'll see it right over here as an abbreviation, DR, I've got it turned way down. What dynamic range is numbers of shades of gray. So it's your contrast. So if you turn it way down, everything's going to be really black and white. And that works really well for guiding a needle because it makes that needle stand out as a really bright line. Or when you turn it to a really high dynamic range, that's the only setting that I changed here, was going from really low to really high. We'll go back to that low, and you see how black and white that is compared to all the shades that we see here. High dynamic range is really good for some soft tissue situations, for looking at some of the ligaments and tendons. You can see a lot of detail in there, but you're best served going with something kind of in the middle for most situations, and your transducers are going to come preset right in the middle. So I would not adjust it except for when you're doing needle guidance. And you can set a very specific preset in your machine with a lower dynamic range, or you can just hit the knob and drop it a couple of clicks right before you start driving that needle, and it will really help you see that needle when you're going in. So here's that just right. It's that balance in between. So we can see all of our lines, we see all of our stuff, but it's not too grayed out. It's not too black and white. So this is too many shades of gray, too black and white, down to just right. And so just right is where most of your transducer presets are going to live. So that's not the only time you really want to adjust that. Like I said, is if you're about to do a procedure and you really want that needle to pop or stand out for you, drop that dynamic range. It really makes a difference. Now, any questions about that?
Sorry, one of the questions that I got, and it was probably something that I was going to ask you later anyway, is are there any video trainings out there that you recommend? I'm assuming that you probably have some type of training associated with TenVision when people purchase a product, but I guess if people already have something and they want to better their skills, do you recommend any different training modules?
There are a handful of videos out there, training modules. None of them are substitutes for getting somebody in-house and getting that hands-on training. I've watched a lot of videos, but none of them is a good substitute for really getting your hands on. If you're learning how to do needle guidance, get a Phantom or make a Phantom. And just practice, get that hand-eye coordination down, because it does not come naturally to anybody. It's a skill that is learned with a lot of practice. If you have an instructor that can come in, that is something that I do. I would love to come out and visit. I can do needle guidance trainings. I did that for several years. I traveled around working with different surgeons, teaching different needle guiding techniques, and just running your ultrasound, really getting that optimized. There's no substitute for taking the machine you have and having somebody who understands ultrasound really tweak those settings and help you to understand how to make that machine go. With those adjustments that I was talking about, that's going to help a lot. If just looking at your machine, try to find those settings, adjust them, tweak them, and see if that helps all by itself. A couple other things that I do want to talk about if we have time.
Oh, yeah, we have plenty of time. I was just asking questions. Actually, somebody wanted to know what a phantom is because you mentioned phantom. So, no, I was just answering the questions as they came up, but it's your time. Absolutely. You do whatever you want to do.
Yeah, no, I like to hear them as they come up, just because that way, especially if it's something here, while I'm on that topic, I'd like to hammer that one home. But I do have a phantom here that I'll pull on camera here in a few minutes, and I can kind of show you how that works. But a phantom, basically, in fact, so this one is just a block. This is actually a vascular phantom. It has built into it several blood vessels and allows you to ultrasound this and advance needles into it, trying to hit those blood vessels. It's really handy for training, but it's also handy for quite a few other things.
Are those available, John, in, for example, lower extremity? Because obviously the people attending this are podiatric physicians and surgeons, and we're going to be looking at the lower-legged foot. Are there phantoms available that would help with that?
As far as just having experience ultrasounding ankles and feet, the beauty of ultrasound is there's no radiation, no harm. I would just sit down in your office after work, pull your shoe off, and start ultrasounding your foot.
Well, I meant for the phantom with the injections. I don't want to play around and inject my foot. So somebody else may want to do that, but I did that when I was in medical school, but I don't want to do it again.
No, don't put needles in yourself or other people for practice. This phantom would be great. It's needle guidance is needle guidance. It does not have to be a foot specific piece of anatomy. Probably the most cost-effective way to get training with needle placement is Jello. So what I like to do, you just make up a big batch of Jello while it's hot, pour some into a pan, let that firm up some, drop a couple of BBs on there, and then pour some more Jello on top, let that firm up so that you have these BBs inside of some Jello. And that will last you for 30 or 45 minutes worth of practice, and just locate that BB with ultrasound and just tap the BB with your needle. Just, guide it in with your ultrasound and just get to where you can touch those BBs, quick and easy with your ultrasound in the Jello. Once you do that a few times, it starts building that coordination, what the transducer hand is doing versus what that needle is doing while you're watching it on screen. Once you have that practice, it doesn't cost but $1, $2 for some Jello packs and a couple of BBs or anything else. A lot of guys will they put all sorts of wacky things in their Jello for targets. Some people will actually use turkey breast, or they'll use steaks or rump roasts. I've seen all kinds of things used. Jello is my favorite to use because it's cheap, and I don't feel like I'm getting my transducer contaminated with meat. But that's probably the single best, cheapest, easiest way to practice working with your needles is build yourself a couple of cheap phantoms. The professional phantoms like this are definitely available online. They have them for all sorts of pieces of anatomy, but they start at the $150, $200 mark and go up from there. So you can go through an awful lot of Jello and you'll be an expert before you get to the $200 mark.
Someone wants to know if they can use steak, prime rib, ribeye.
Absolutely. Yep, steak works great. It makes a good phantom, but it is more expensive than Jello.
Yeah.
You can get expired cuts for cheap. I know people who do that. If they find something in their freezer that's totally freezer burned and ruined, instead of throwing it away, they'll slice it open, throw some targets in there, close it back up, and start using that for practice. I know people who do that. It's worked well for them. They don't let anything go to waste. But so one of the things that I wanted to hit on is actual scan technique. So when you're scanning, one of the most important things that I see a lot of people not doing is anchoring their hand. So when you're ultrasounding something, don't hold the transducer up here and then try to scan something with just free floating. It is really hard to hold still, really difficult to control your transducer and stay and really image that anatomy well. And then if you're doing needle guidance, it's even more important because you're not watching your transducer, you're watching the screen, and that transducer will start to slide with that gel. So always grip the transducer a little bit lower and use your pinky. I use my pinky a lot. In fact, go to camera 2 for me. So, this is kind of a zoom in, but I'll anchor that pinky and keep that pinky pressed against the skin. And that allows me to really maneuver that transducer around with absolute control because that pinky never moves. It's anchored onto that anatomy. And so I can lock that in and know that it is not going anywhere. So always have part of your scanning hand, whether it's the heel of your hand anchored, whether it's your pinky anchored, something has got to have contact with that patient on that scan hand to anchor your transducer to have full control of that transducer while you're scanning. I see it all the time. Go ahead and go back to 1. That is a very, very common thing that I see. People, they just can't keep the image still. You're looking at the ultrasound image and you're getting seasick watching it moving back and forth and swimming around. They never get that sharp, crisp image they're looking for. A lot of times it's just because they're up here floating around with their transducer, afraid to touch the patient with their scan hand. So set that heel of your hand down on the patient if you can. If there's nowhere to put it, if you're on the end of a foot and there's just toes over there and you can't do that, use your pinky to maintain some sort of contact with that foot while you're scanning it. And that will improve your imaging dramatically. The other thing that I wanted to talk about with transducers is the hockey stick. The foot is a difficult thing to image. There's a lot of curves. Very rare do you have a nice long flat space that you can put that transducer down and get a full image, especially when you get to toes, especially if they're bent up and twisted. It makes for a really difficult image. And so usually you only get a little piece of your screen that's actually showing the image you want. So that's where this hockey stick really comes into its own. If you're doing toes, especially if you're doing injections into the joints in the toes, things like that, this big transducer is just going to get in the way. It's very difficult to image and especially to do any procedures with needles with that big transducer on a curved, twisted up foot. So I highly recommend that you get like a hockey stick type transducer. What this allows you to do is it gets your hand out of the way. Once again, you're still going to anchor. Go ahead and go over to camera 2 for me. So you're still going to anchor that hand, but now you're imaging with that hockey stick, and you can see even bent, smaller structures. If you're doing toes, if they're all twisted up, you can still get that footprint on there and image those joints, those ligaments, tendons. It will enable you to see a whole lot more than that bigger footprint. The other time that this really comes in handy is for procedures. When you're doing needle guidance, this transducer is very helpful for your small, any needle sticks in the foot, toe, anything superficial. This thing is going to be extremely helpful. The one thing that you need to be careful of with this transducer is orientation. And I see a lot of people get confused with these just because the way they're set up. So if I'm holding this transducer in this plane right here, the toe of this transducer is this side of the image. So, if I'm putting a needle in the patient like this, it's actually going to be coming down this way on my image, which is backwards from how I'm going in. And it makes for a real disconnect when you're trying to do this procedure. So if I'm over on, this other side of the room, I'm holding my hockey stick here and trying to stay out of the camera. I'm driving this needle in, but it's coming in on this side of the screen. That can be difficult. So there is always on every machine a way to flip this image. So if you find yourself in that situation a lot, you can, so there's a little S, and every machine is going to have a little logo in this top left corner of the image. And you can flip. So now that logo is on this side. And so the tip of this corresponds to where that logo is. And so now when I'm going in, the needle is going to be coming in from that side of the screen. So we're same. So, I've seen a lot of people complain about hockey sticks. And, because of that issue, and I'll see them try to flip it around and try to sneak in underneath of them and try to get that in just so that it's oriented correctly on screen. Don't do that. Just find that reverse button, flip your image on the screen, and now it matches what you're doing. It's pretty simple to do on most machines and really handy for, getting that guided in. But what this really excels at is getting your hand out of the way. So when you're doing that procedure, I have all of this real estate over here to drive that needle in, without that big bulky transducer in the way. Plus you get to see, those smaller joints, those smaller items, really handy thing to have. I would highly recommend for specifically what you guys are doing with the ultrasound machine, that hockey stick really comes in handy. Any questions about that?
No questions regarding that, John. I think that actually I wish I would have seen the hockey stick when I was actually in clinical practice doing things. Looks like it would have been a great tool for me.
Yeah. They, I don't recommend them to a lot of people, but for what you guys are doing specifically, the hockey stick really is going to make a difference. So if you have the option of picking up a machine with a standard linear and a hockey stick, get both. Even if you find you don't use it much in the very beginning and you think, why did I spend the money on that hockey stick? The more you do and the more you use it, the more you'll think, holy cow, I can't believe I lived without this thing. They really are a handy tool.
Does it make you more efficient, John?
Yes, it does. Absolutely. You'll be able to identify the anatomy a lot easier. And so remember what I was saying about that artifact that you get if you don't hit those ligaments and tendons dead on, if you're hitting them at an angle. That's one of the things this hockey stick is really good at. As you're coming around the anatomy, this hockey stick can follow those ligaments and tendons a whole lot easier than this big flat transducer.
John, if people bought a machine that did not have a hockey stick with it, Can they buy it as like an add-on accessory for a machine that they already have?
Yeah.
I've gotten some questions from some of our attendees. Obviously, some of them have their own machines already or an older machine. Is this something that is something they could purchase from somewhere? And what do these hockey sticks normally run, cost-wise?
For the Sonoscape machine, this hockey stick runs about $2,500. For Philips or GE, depending, I hate to give numbers on those because it varies depending on the machine. But you're looking at anywhere from 2,000 up to 5,000 or 6,000, depending on the machine that you're using. And whether or not you can do it with a refurbished transducer, or if you absolutely have to have a brand new transducer, that will depend on your machine and what you need.
So you can buy these. You can buy these transducers refurbished.
Yes, sir.
Great.
Yeah. TenVision does that. That's something that we do offer here. There are also other places that you can buy them, but I know that we do have them here at TenVision for.
That was the beauty about TenVision, that when we partnered with them originally with Taylor, is that they had new as well as refurbished products. So depending on what you were looking for, and they weren't dependent on any one particular vendor, they had a multitude of different machines available. Right.
Yeah, we are a multi-vendor platform. We have just about every major manufacturer here in house. Sonoscape is we only have a couple of offerings in the new category. Most of what we offer are the refurbished machines. The Sonoscape products are new. GE, Philips, and many of the others, they're refurbished, but that actually brings them within a reasonable price range. And the company I worked for before TenVision, I worked there for 13 years. Every machine and transducer we had, we bought from TenVision. That's how I became familiar with TenVision and how I eventually got recruited away.
Well, that's awesome. Are there any other things that you want to cover? I've got a few other questions that have come on, but we're in no rush. We've still got about 10 minutes.
Yeah. So one more thing that's kind of particular about the foot that is kind of cool. If you're trying to do an injection into the sole of the foot, especially in the forefoot area, or if you're just trying to locate a foreign body, especially if the patient stepped on a needle, has a needle stuck in their foot, and you're trying to go after it, and you don't really want to use X-ray, maybe they're a pediatric patient, so you can actually see in between the metatarsals, and actually put the transducer on one side of the foot and locate that foreign body, and come in from the other side of the foot with ultrasound guidance and grab that foreign body. It's kind of cool. There's not a whole lot of places in the body that you can do that, but this is one of them. So this is actually my foot. I have the transducer on the back, and there I'm poking on the sole of my foot there.
Now we can see it. We couldn't see it before.
Oh, sorry. Switch to camera 3, please. There we go. So the transducer is, like I said, placed on the top of my foot. The plantar surface of my foot is what I'm poking on there, shooting in between the metatarsals of the foot. So if there was a foreign body or anything, it's easy to locate, easy to go in with a needle or a pair of forceps or something to grab that foreign body and pull that out with this ultrasound guidance. But you can see really well in between the bones, to do that. If they have a growth or any kind of something on the sole of their foot or on the top of their foot, you can always come around to the other side of the foot to ultrasound it and then attack it from that angle. So that's a really cool option that we have on the foot. So go ahead and go back to camera 2 for me, please. So basically what I'm doing here is ultrasounding on this side of the foot and then accessing it on this side. And just coming straight at the transducer from the opposite side.
John, when I used to look at intermetatarsal neuromas, I would push from the plantar aspect of the foot over the interspace, and you could see if there was an enlarged nerve for the neuroma.
Yeah, so it's a very handy technique. One, and something that you don't want to forget about when you're ultrasounding. Just being able to visualize between those. So any other questions on the settings of the machine?
No, but not in particular. I want to go back to one of the questions that was asked earlier about some standard settings, and the reason why I ask is when I was ultrasounding at the time, one of the machine that I had, depending on like if I was looking at plantar fascia or if I was looking at an ankle, there were some settings that I could put on the machine so that that when even when I chose those, it actually annotated what part of the body I was looking at because it was like a program for that. So I guess there are probably some standard settings depending on whether you're looking at an Achilles tendon or the plantar fascia or maybe for a bone cyst or a fracture. So I think that might have been what the other person was asking as far as I know there's not an overall global, but I used to make it based on the body part the area on the foot that I was scanning.
Right. Yes. And that is something that every machine can be set up to do. Machines come from the factory with a certain number of presets that the factory kind of optimized for that particular item. Go ahead and go to camera 2 for me. So, when I go to select the transducer, so you're going to see a lot of options across here. Go ahead and go to camera 3. We have carotid, thyroid, breast tissue, superficial, testicular. So all of these different settings, upper extremity nerve, a deep nerve, all of these different settings are going to put it ballparked in an optimized setting for that piece of anatomy. So we can go back to 1. And that is something that is fully customizable on pretty much every machine out there. And that's what I would recommend doing is setting your machine, find that real sweet spot. You get a superficial setting, base setting from the factory, put it on a foot, start tweaking those knobs, get everything dialed in, and then save that as a preset for the plantar fascia. If you save a preset for a deeper ankle shot, and that way when you hit that select button, you select ankle, plantar fascia, Achilles tendon, and it will automatically come up with the settings that you have preset for that. The annotations, that is another type of setting. Once again, most machines will have annotation packages that are customizable. And that, what it sounds like. Now, were you using a bigger ultrasound machine, full-size machine?
At the time, I was using a MyLab 1 Sayote.
Okay. Yeah. Okay. I've used one of those, and they actually do have a pretty good package as far as the annotations go, and walking you through labeling the anatomy like that. So about half the machines in this portable market will have annotation packages similar to that. The other half, you'll either do a little bit of typing or, it's just a little bit more work. You hit the annotation button, it pulls up a drop-down list. You select that annotation and put it in. It takes 2 or 3 clicks to get there. But I always tell everybody that the more work you put in on the front end, the better it's going to be on the back end. So if you put in the annotations and you set everything up,
when I had the different things, whether it was plantar fascia, metatarsal, neuroma, it was all in annotation so that when I was in the room, as I was viewing, I could label what I wanted to do and then save it and be done when I left. I didn't have to manually type everything in other than the laterality.
Yep, that's exactly right. And that's pretty much every machine can be set up that way. And they all are customizable. So you can set them with your own annotations the way you like it worded. And definitely that's when you purchase an ultrasound machine, that's, if you buy from a vendor, they usually will give you 1 or 2 days of applications training. And that's when you have that person, if you buy from 10 Vision, I would be the guy. I would come in, I would work with you for a day or two, depending on what you got, how you got it. And we would set that machine fully customized for your office. We would set all of those presets, set all of the annotations, get all of that built for you so that when I left after I was done, everything's pretty much plug and play. You just hit a button or two and you get your job done with minimal fuss.
That's awesome. John, I usually try and keep this on time, and but I'm going to ask you one last question. Mm-hmm. What I want to know is the people that are on here, what are some of the factors that they should consider when looking at machines? I mean, you mentioned that you had multiple platforms and you guys do refurbished machines. You talked about the hockey stick. What should people consider when they're looking for a machine?
The first thing you need to look at is exactly what type of imaging you're doing. With you guys, that's easy. So you want a machine that runs a linear and a hockey stick if you can. You don't need a full-size flagship shared service machine. That's going to be $60,000, $70,000, $80,000 that you really don't need to spend on a machine. You need a machine that has good superficial imaging. Lots of 5-year-old refurbished laptop style machines will do fine work for you. This laptop machine does great work. We've had a lot of good success with this one. There are a handful of tablet style machines that are touchscreen, and they do good work for you. But the main thing I would look at is the company you're buying it from. If you just don't have a budget, you need something, you're looking on eBay, good luck. You might score really, really well, get a great machine for a cheap price. It does happen. But you may get a machine in the mail that just doesn't even turn on. So I would recommend buying from a reputable seller, whether it's a manufacturer from 10 Vision. There are a couple other outfits like 10 Vision that have machines. But do they have an applications person that will help you learn how to use the machine and set it up for you? That is more important than the brand, honestly. Getting somebody in that can teach you really how to make that machine go is probably the most important part of that process, because I can make you happy and get what needs to be done with a bottom of the line tablet type machine. You'll be able to get your job done if you know how to optimize it and use it right. If you buy a $50,000 machine, but you don't have anybody to teach you how to use it, you're going to be in the same shape you were in if you had just spent $5,000 on an eBay machine. You're just going to be frustrated because they're not going to be set up. The images aren't going to do what you need them to do.
That makes complete sense.
Buy from somebody that has somebody that can come out and actually teach you how to run it. These things are race cars nowadays. You don't buy a race car and just go out in the street and hit the gas. You need to learn how to drive those things. Really optimize them and make them do what you need. Other than that, look at warranties. Look at the service plans the companies have. Service plans might be something you want. They might be something that you're willing to take a chance with. But make that decision knowing what you're deciding. Some machines, if you don't get a service, they may not go down for 3 or 4 years, And yeah, you just saved several $1,000s a year in service plan. But one critical failure on a machine will, number one, you're out of ultrasound machine until somebody gets it fixed. Number two, you're looking at $5,000 to $10,000 to fix a machine. So, with a good service plan, typically a company will get you back up and running very quickly with minimal downtime. That's something TenVision prides themselves in, is minimal downtime for our customers. But just, when you're searching for somebody to buy from, get somebody who's willing to talk to you about multiple machines, what machines fit your office the best. Do you need a battery powered machine that can, be carried around the office unplugged? Or are you okay with a small stand-up machine that has to be plugged in, turned on at the beginning of the day, but stays stationary? You might be able to save a little bit of money by getting an older stationary machine.
Right.
It really depends on your situation. But talking to somebody at the company that can really work you through the options, figure out what machine fits your office the best, and then get you trained on that machine, get it presetted, you'll be much happier with the machine.
Makes complete sense, John. And I think listening to what you just said kind of ties everything in with who we are at Taylor. We've been partners with TenVision since we started. I think that everything that you described is what we're looking for in our vendors. It's not just the best price. Buying a machine that you can't use and can't service is not going to do anything. So I thank you very much for joining us tonight, and I want to thank everybody who participated. I want to remind everybody that reach out to our team, and we'll get you the contact information for TenVision if you have an interest in calling and finding out about products. And they're there to help you, and they've, as I said, they've been a great partner for us. And I'm hoping that I get to see everybody next week, in 2 weeks, when we have the evolution of foot orthotics, incorporating objective dynamic data into orthotic design, presented by Paul Graham. Orthotics have changed since I started practicing 30 years ago. The way they're molded, the way they're made, the way they're scanned, the way they're posted. We've got to keep up with technology and learn what's going on. So please join us in 2 weeks for the evolution of foot orthotics on May 5th. And John, again, I want to thank you and TenVision very much for coming on. And everybody, thank you for joining us on Taylor Tuesday. We'll see you in 2 weeks. Have a nice night.
Yep. Thank you.